Hi guys, welcome to our channel. Today we'll be having the interview of the Dr. Mohan who have recently cleared the AMC Step 1. So heartily congratulations Dr. Mohan for your AMC clearance. And so he is also my batchmate and DMSF alumni and so proud of you for the clearance of this AMC Step 1. So please tell us about yourself to audience.
Yeah. Thank you, Bharath. Thank you, Dr. Bharath. And also, thanks for your congratulations. And so, about myself, I did the same. I mean, I graduated along with you in the same year, but I stayed back there for 1 year to do this internship at the DMSF for my CV to help this Australia pathway. So, I actually took the decision even when I'm still at my graduation year. So, I
Okay.
just decided that time itself to stay back and just get this clinical experience and then prepare for this exam. And I cleared
Okay.
this exam on this April 2026.
So what was your reaction when you received the AMC results and it Step 1 was cleared?
I mean, I was at work. I mean, so I was just checking my results. So, I mean, the time it took for the preparation and the uncertainty whether I'm going to able to write this year or not, and all the stress that I was through with this preparation phase. So it's like it's just relief because that the moment after I finished my exam, like in the exam center, so at that time I thought like, yeah, I did what I have to do. I just gave my
Yeah.
like whatever I can do. So I'm like, yeah, let it be. Let's just fate decide and the God decide. So I'm like, after when the results came, so I was in like in between. I'm like, I will accept anything is fine. I'm just being optimistic, but not too overconfident. So
Yeah.
when I got the results, I was like, yeah, okay, done. So one thing is done, and the next thing is about like, I mean, when I was preparing, I thought like this is the main thing that I should be like achieving it. But after like when I crossed that one step, and then I was like more of into, so what's next? So what should I do? So I'm starting being clueless again. Like however you guys are clueless in this step, so I'm also the
Yeah.
same level because we are more of like let's just see the next step after clearing first this one and then we'll see later. Not like getting all everything at once, not dealing with everything once. So it's that's what my exact situation was when I received that. Not, I mean, I am glad that I cleared it in one go because it's not just the time; it's also your financial thing that you have to the aspect of it. Yeah,
Okay.
that's it. Mhm.
So why did you
Mhm.
choose the AMC? Like,
Yeah. Mhm.
what was the journey with this AMC Step 1?
Mm. Because as we know, right, when we are studying in abroad as an FMG, they call FMG, like foreign medical graduate. So we can see like how India differs in aspects of how the patients treat you as a doctor, how they see you as, and also how the system treats you, and how the
Yeah.
system is different in postgrad in doing the residency, so post graduation specialities and all. So and also I'm a person who wants to have a work life balance. It's more of like I want to be like having I want to have a personal time and also professional time balance, not just just overload with the work, like not just
Yeah.
having this for life just work. So that was my first idea when I was in fourth year. This like random, I'm just searching what can we do. So I just ended up in YouTube searching things. So I ended up like knowing about this Australia pathway. But these years there was like lot of changes in how the system there is because like the competition is increasing these days.
Data.
So it's getting saturated, yes, but it's not like we don't have opportunity. We do have, but we have to be strategic and also we have to like when we are in these early stages, right? We have to like we have to be very strategic, like what we're gonna do, like some CPD courses, any researchers, any publishers. We have to stand out in the crowd. That's it. Yeah.
Yeah. So how was this journey and how you are feeling? You are still in the beginning only.
Yes. I mean, after our graduation, we started our internship from May 2024 to May 2026. After that, I came back to India in September 2026. So, and from that on time, I was attending the Zoom classes, usual discussions about this AMC preparations. Like usually there will be free discussion, Zoom sessions that will be conducted by some volunteers.
Okay.
I mean, like there are kind of resources, free resources that I will just share.
Hmm.
So what happens is like you can just attend these sessions that will be helpful. They will be guiding like what about the topics. They will discuss about the topics and all. So I used to do like not consistently, but most of like 5 hours a day, something like that. So, but after when I started, like from December, I started to sit for my exam. That's the time when I
Mm.
booked my exam, December 21. So from that day, I started to study like consistently. And one main thing is we have to have a study partner. That's important.
Yeah.
You can do without a study partner, but having a study partner boosts you. That's like even if you don't feel like not to study today, you don't feel like you will feel like a phase where it's more of like it's hard to sit for some time. But once you get a partner, like they will see at the concept differently. They will have their POV. It's different how they can. You can just help each other. And we used to study like an average of 10 to 12 hours a day from December 21st to until our exam day. And especially talking about the prep phase, it includes like different materials. The main thing is the e-medici. E-medici is a
Yeah.
question bank that we use to solve the questions. And also you have to be with theory. As an FMGE, we already have this exam, right? We all most probably we all. I mean, whoever watches this video, they would already like passed this exam. So they will already know like the work. I mean, like the stress. They would have already handled with the stress, like sitting for 4 5 months and then preparing for this exam. So it's gonna be the
Yes.
same, but not to extent because I haven't prepared for FMGE first. It's my first go with just with the AMC. So you would be
Okay.
already done with the basics. But I will just warn you guys, like it's mostly like not just the basics. It's more of like on the clinical side. It includes more of on the clinical side because they will give you all the relevant information that's needed, like a clinical scenario. Like you are a doctor here, and they will also mention the setting that you're seeing the patient in. Like let's suppose the question can be in the ER department. The question can be in like a GP setting. GP setting is more of like a clinic. So
Yeah.
so it varies. The how you answer for the same situation might varies because some is not available. Like some investigations are not available in a clinic, but can be available in ER. And some doctors, like seniors, are not, like you are alone in the clinic, but not in the ER. And how you want to escalate things, like next step, investigation, best investigations. So you have to be familiar with the question. It's just not the theory. How you just apply your theory in the specific scenario, and you have to understand what the question is actually asking you. That's what is important in this thing. So, and also you have to have the guidelines. So guidelines
So
is,
more
mhm,
mostly it was like diagnosis, treatment plan, how the decision will be
mhm,
making in that particular
mhm,
scenario.
mhm. So it's mostly like of, let's say, it's not gonna be a one-line answer. And it's I will just for make to make it easier, I gave my exam in FMGE in January, right? I mean, I was just gave it like let's see like how it's gonna be. I was preparing for my AMC as well. I just took one day off to just go and give my exam.
FMG.
Yeah, FMG. So even I was not able to pass that because I haven't prepared at all. I mean, I just scored like 135. So
Okay.
what this is more of like I saw is when you're preparing for AMC, you have to rule out four options to get into the answer. It's more really it involves five options. So for FMG, what made me easy is like I already familiar with solving five options for a question. So when I'm
Mm.
seeing these FMC questions, it's easier for me. I just have to rule out three options. And it's also how the surgery questions, how are the like they were saying that it's a STEM. It's like all integrated questions, like subjects are integrated. That's how the AMC will also be. They
AMC is
will,
also like
yeah.
mostly similar to that.
Hmm. So it will include all integrated questions, mostly integrated. Like they will say like this is the. I mean, you can correlate things. You have to correlate things, not just with the integrated. I mean, like with the subjects, but it also involves different scenarios. As I said earlier, you also have to include where in what setting you are and what is in which level the doctor you are and what is that they're asking the question about like investigations or next step. What's the diagnosis? What can be the this thing? So it differs. So we have to be very understandable. Like we have to be very careful to understand what the question is actually asking us, what they want us to get out of us. So you have to build that intuition. So for us to build, we have to do questions. We have to practice. We have to practice more and more. So the question bank is eMedici. It used to be Amadex, and there are other before Amadex and some others are there. But now the AMC directly itself recommends eMedici to eMedici
E-medicine
as a
to use
source.
that.
So yeah.
So as you
So
just compared with the FMG, right?
mhm,
So how
mhm,
did you feel like? How was the difficulty
mhm,
comparing to the
mhm,
exams,
mhm,
different
mhm.
exams?
Yeah, so I just be honest. What I said is I haven't invested any much of amount in FMG. I haven't read anything about it, and also it's like so I don't know. Like you see. if I have studied it, if I had invested the time in it, and I just studied my best in it, and I would know, like I know about these topics. Yeah, I covered this topics from this subject, and then I mean, like then I gave the exam. Then I would know the hardness. I mean, like the difficulty level of it. So I can't correlate things, but both of the exams are hard. Like they are like easy. We can't compare. Let's say like I heard people saying that there are some consultancies. They're saying that if you haven't passed FMG, then go for AMC. It's very easy.
Hmm.
Let's say like maybe if you say that, if you're really saying that just for sake of you getting into admissions, you just want to make some money out of it. It's not true, because it's not just end with AMC one. You have to pass AMC two. You have to
Yes.
get you have to make a good CV. You have to have a good clinical exposure, because you're talking about like a first world country. So are they gonna be that easier? You say, I mean, like, so we have to just think like why they are like is this sugar coated? Is it reality or not? That's what is
And
there. We
also, it
can
is
also.
most time taking, money taking.
It is, and it includes two ten questions, yeah. And the way they mark, it's different. That's what is different. It's an adaptive test. It's not a usual test that we like FMGA. FMGA includes one question. I mean, every question is graded same marks, right?
Yeah.
But in FMGE, it's different. It's graded according to the difficulty of the questions, and it's graded according to like how the others are performing it. They will compare how you performed it. Let's say like.
Yes. Yes, the same
Mhm,
doubt I had that what was the
mhm,
scoring system regarding the AMC? It
mhm.
was completely different
So.
from the any
Mhm.
exam, like you take IES, MLE, or even or the
Mm,
NEET PG also. It was different
mm,
from the scoring system of AMC.
So about that, what we say, it's like this. Let's say like usually they will also have this concept called recall questions. Recall questions are more of, yeah, this is also that. It's not going to be A to Z the same question or same options. They will even change the verbs, nouns in the option. They will go to that extent. And coming to
Okay.
this adaptive test is the algorithm, how it works is, let's say like you have 210 questions. So 210 questions is a usual total number of questions that will include, and the question changes accordingly, like how you answer.
Mm.
Mhm. And like one question is marked like let's say like 2 marks. Other question can be scored like 5. Other question can be 4 marks. We don't know actually. So what we know is like they are not scored equally, and they will scored accordingly to how difficult is a question and how level is. I mean, like they will say that if you do the emergency question, there will be some questions. They would say that this question is not expected to be answered by your level, because it's more of like a
Okay.
consultant levels. So if you answer it
Mm.
correctly, you will get more marks out of it, because they are not expecting you to answer it. You're not like for our level. So if we
Mm.
answer it, that's a bonus point for us. And it's also bonus point if everyone are answering it wrong, but you're able to answer it, then you will be created more score.
Even the
And
score will be increasing.
yeah, so that's how
Mm.
it works, and that's why you have to be strategic. And it's also when you see, like for example, for people that are already in this journey, they will know something called Blue Book. So in the
Mm.
Blue Book, AMC Blue Book, I mean, we are not using that anymore. We're just using only for the pictures in it. We just want to
Okay.
use see the clinical pictures, like some PE findings and some histology slides, something like that. We're not
Mm.
using that because it's outdated. It's long time. So in that there is like like example, like how the exam will be. In down there will be a brackets, like there will be statistics, like this number of percentage of people were able to answer this correctly. This number of percentage were able to like not able to answer it correctly. So they will also see
Okay.
that statistics. So that's how your
Mhm.
performance also depends. That's one way of their marking the answer, like how much weightage it actually have. That's that's why
So
it
it was
changes.
like there is no negative scoring, but they will give the bonus scoring depends on our difficulty level answering.
Yes, and that's also depends like how much like how difficult, like let's say like it's easier question. I also heard it, but I'm not so sure. I also heard this, like if it's a easier question, you were able to answer it wrong. I mean, you gave a wrong answer, and then you are next. It's gonna affect you negatively.
Okay.
Yeah, because
Even
you're
though if you
expecting.
answer, yeah,
Uh,
yeah, I get it.
So that's how it is. So it's a kind of like tricky. That's why if you're feeling that your exam went easy, so that's what like we also have to think up it. Like we have to be careful. Are we correct? Are we like doing it correctly or not? And I was wrong. I was mentioning you 210 questions. Like it's not 210. It's 150 questions. That's no total number of
Okay.
150 questions. 210 questions is what you get from eMedicine. when you want to
Hmm.
practice. That's like similar to the exam, like
In the
exam
150,
questions.
how many we have to answer?
That's what see 150 is the questions, right? But your score is
Hmm.
for 500.
Score is for 500.
100, yes. So that's
So
why it's
passing
very
score
difficult.
will be
250.
250.
And
Okay.
there was like a recent update, not recent, but it was last year December when I started initially my prep. We got a mail. Everyone got a mail from AMC that they are increasing the standards for the exam. Like they're increasing the
Okay.
standards of the exam difficulty in comparison. Like they're making it fair for the Australian graduates there. So they increase the. So that's also one thing. I'm not saying it to just, make them like worry about this, but I'm just saying what is now, right now in the scenario.
It was new
But
update.
mhm. So yeah, and it's also so main. So yeah, that's it. And yeah, next we'll just catch up according to your questions. I might just mix things
Yeah.
up.
So how you started? What are the steps included? What are the
Mm,
documents?
mhm. So
So before the
usually,
process, we start the
mm,
applying. So what are the
mm,
from our college, from
mm.
any university? What are the steps?
Mm. You just need only like passport. You'll start with passport,
Okay.
and then your picture, your like your picture and your signature. That's picture. So what we first do is like we just verify ourselves that we are like we have we match our identity and all. First, you
Okay.
just make your profile, and then next, that's called notary cam notary, notary cam something. So that's what is called. After that, what you do, this is in all in Intel. INTEALTH, Intel. So this is in
Okay.
Intel. You have that's a separate body. That's what they do is like they will verify the person and they will verify the degrees whether they are legit or not. So after once it's properly done, then you will go into AMC1 website, and they will put the Intel ID there. So what they do is like
Hmm.
they will retrieve the documents whether they are legit or not from Intel. Okay,
Hmm.
so that's like a verifying body
It's like
agency.
registration and verification.
Yeah, yeah. So they will do that, and after that in AMC one, they will you will I mean like you will create your portfolio. I mean like your account, basic account, and you will pay, and then you will put
Hmm.
this Intel, and they will just accept all the documents, and then you can apply for your. I mean like they will also have this like you have to pay. In every step there will be a payment, so you have to
Yeah.
be prepared with the payments before then applying for those. And it's also so after first step after notary camp, then you will go into something called you're uploading your documents, medical degree. So it
Hmm.
primarily involves medical degree and your passport. That's it. No more, nothing. You just don't need any more. So some will ask you that if they're still in medical, like if they're still in medical college, they can still apply. They can't because you will get the degree only after you're done with your graduation.
Yeah.
And they don't need any license. I don't have any license when I applied, so there is no need. Uh, and yes, after that, it will take some like the Intel process would actually take like at least 1 to 2 months. It varies from person to person. I mean, I helped some
Hmm.
of our friends and batchmates like for this thing. For some people, it was in less than 1 month to all verify all those documents. But for some people, it took some time. And it's also one more thing in Intel. What they do is like once you upload our medical degree, right? They will send
Hmm.
to our college, I mean, our DMSF, our medical
Hmm.
school. They will send it to verify it. So what you have to do, we have to inform our medical school that they're gonna receive this email from this organization about our name. Like you have to let them know. So
Like
they
all
will
the
they will
documents
just.
verification
Mm,
also. Hmm.
mm. I mean, there is no need. Like you can just tell them they will receive a like inquiry from this organization about me. So you just
Hmm.
process it. That's it. Just give them a heads up so they will know and they will just do it. Once it's done, it's gonna be like it will be showing that it's all done in your Intel account. Hmm. And after
So
this,
it.
you will go mhm.
Hmm.
After this, your Intel portfolio is created. Then you will go into AMC1, AMC website, and you will register your account, your student, I mean, like your account, and then you will export all this Intel to verify credentials, and they will recognize it. And after that, you will just book for your exam. Booking for exam, this is where you have to prepare with your exam fees because that's more of like it will be almost to 190,000 IML, 1,90,000,
1,90,000.
90,000, and that's like one-time payment you have to do. You just go
Yeah.
with a credit card or any card that's like less international charges. I'm just saying that you will not because it's actually you will have more, if we will have more charges of this conversion rate and tax charges, so you have to be prepared. You will just wonder why is it this, I mean, like, because in website if you convert it, it's less than 190,000, but when you
Hmm.
just charge, it will be more, like 10,000 or 15,000 more. So you have to make sure that you have that limit of card limit, so that you will
Hmm.
not be like,
Okay.
mhm.
Extra
So
charges will not be cut.
I
So how
mean,
much is for the
essentially
Intel?
Intel, Intel actually is more of like something. It's in bits. It's more of like 20,000. I mean, I'm not. I will just tell you this. What do you call? In dollar, in AUD dollars, if it's okay. Yeah. So for this thing, this Epic, this is the same thing. This is ECFMG, Epic, Intel. These are like the bodies that actually verifies our document and ours. It's like 110 USD, 110 US
Hmm.
dollars.
110 USD dollars.
So it's around like less than 15,000, right?
Hmm.
Comes around. And then notary fees. Notary is like the notary camp that I told you. It doesn't have any payment. And then you have to do this Epic registration. That's 35 USD dollars. And
35
there's
USD.
and I told you, right, when we are uploading this, medical degree, we have to pay some
Yeah.
amount to it. So depending upon how many documents you add on, like you can
Hmm.
add like multiple documents you can have, but there is no need. Just one medical degree is enough. Your degree, I mean, like graduation certificate. That's like, say again, 110 US dollars. And
110 US
then,
dollars for that.
mhm. And then for AMC portfolio, you will have this 650 Australian dollars. Here you see there is
650.
like a change. It was US dollars, but now it's Australian dollars because this is when you're transitioning. Like this is AMC you're doing this in AMC portfolio. Before that, you verified everything yourself and your documents in a agency that actually verifies your identity and your degrees. That's world wide. That's
Okay.
the same for USMLE and everything. That's body.
Hmm.
That's ECFMG, Epic, Intel.
Yeah.
I will
ECFMG for
send.
the. Hmm.
Mhm. So I sent you the text. I mean,
How
for the
much is that?
details of the prices. Yeah, and this
Hmm.
AMC portfolio, it will be 650 AUD. I
650
told you,
AUD.
right? So 650 AUD in INR for today rate is 43,000.
Okay.
Mm.
They
And this,
these are the
mm,
further pre-step before the exam.
yes, these are all before the exam. Yes,
And for the exam, it is around 1,90,000.
yes.
So how
So
many
mm,
exam, like for example,
how
FMG
much?
is two times a year.
Mm-hmm.
AMC, how many times in a year?
Yeah, it includes like it's that's the advantage. Like you can there will be no exam only in December and January. But other than
Hmm.
those, in every month you will have an exam. In every month there will be 1 week called exam week. So in exam week
Okay.
you will have exam from Monday to Saturday, and then
Hmm.
uh, and in every day there will be a slots according to the location that you choose, and these slots will be filled. I mean, like let's say like for this year, it's already been filled even in April.
Right.
For this all like for all those slots, it's already been filled. So we have to be like fast, and it also depends upon which center we choose.
Hmm. Okay.
And it's also in India. There are like many centers. The one center that I gave is in Hyderabad. So Hyderabad, Chennai, Bangalore, Mumbai, Patna. So there are like many. So you can
So
choose
many
according
locations
to.
is also available in India.
Many locations are available in India. So we can just choose from those.
So it
Mm.
was not like lab. Lab we need like we need to be get the registration immediately. Sometimes slots will be full. So here
Mm.
the slots are also so many available.
Available, but yeah, it's also like you don't want to be in like this. The slots are available, but it also depends upon the location that you're choosing. And if someone is like cancel their exam, then you can just able to book your exam. Yes, so it's better to have your Intel account and AMC portfolio established in earlier than what you're planning when you're planning to book your exam. Let's say like you're planning for next year, so it's better to just get all those done by now itself, even early.
Hmm.
Why no? Yeah, it's okay. 6 months early is better because myself, I started this accounts and I mean like establishing Epic and AMC portfolio from September, right? So from September
Hmm.
to December, I was able to do this, and from December for December itself, there was like the next year, like let's December 2025, and in that time, these slots are open until April,
Okay. Hmm.
until May, I guess, until May 2026, the slots are open. So I was able to book right away. I was in a correct timeline, luckily. So I was
Immediately,
able
yeah.
to, yeah. So I was able to get a slot. I mean, like my preferred slot. So I got it.
Hmm.
Like nearby. I mean, convenient for me to travel and the time, like not in the morning, like this. And after this, so that's what you have to be make sure that you're all ready with your process. Like you paid for the exam and everything. Like you have your amount ready, you have your documents verified and everything. You have your portfolio set up. So this is what you have to be ready when you're planning to just give the exam. That's what I mean.
So documents, although it's not like a more documents, just
No
only
need.
MBBS
Mm,
degree and
mm,
passport. That was
mm.
what needed for the international medical graduates. Not other
Yes.
than that. Like, so
Mm, mm,
how about the mandatory internship
mm,
or the
mm.
internship certificate is such needed?
No, because those are not needed right away for you to give AMC one. Only passport and then this one, passport and
MBBS
then
degree.
your MBBS degree, and you're financially have to be like prepared. That's it. And also, while you're giving the exam, like when you're taking the exam, like you're going to the center, you have to have your Aadhaar card or like any government ID and also ATM card if possible. For me, what they ask is like PAN card. So in PAN card,
Hmm.
you will have your picture and your signature, right? At least your
Yeah,
picture and full name. So that will work. And passport. Just carry two more IDs like Aadhaar card or any bank
voter
ATM.
ID or
Just have
any
your
other.
any full name or your signature on it because those are needed. There are like some people who are like who are not able to give the exam because of these ID discrepancies are there. Okay, you have to make sure that because
Okay.
it's like a one-time thing, it's also like cost so much.
So an internship certificate is not so mandatory as of
It's
for
not
the
so
step
mandatory.
one.
Yeah, step one. It will be a weightage to your CV when it's you're applying for your jobs in like after step one. That's what.
So before the AMC examination, is there mandatory exam with the English examination or you can take later
No,
also?
that's the advantage. Like once you clear the exam, then only you will book for English exam because it's only valid for 2 years. So it's better. It's
Hmm.
like a strategic way. So that's how I planned it. I gave my exam in April, right? April 16. So
Hmm.
my results were in May. So after the May exam, when I passed it, then I plan to give the English exam. In English exam, you can choose to give IELTS, OET, PET, and you
Three
can choose
exams.
this. These three are acceptable. So that
Hmm.
depending upon like which you want, you can just choose. OET is more like it's morely related to our field. It's most of like how you gonna give the recommendation like medical certificates. How you gonna give a health certificate? How you gonna do a referral letter? Like referring this patient to another doctor. So it involves more like around like us. But PT, academic, and IELTS, it's like more of like general language, like English. So that's how
General.
these both yeah, differs.
So how much is cost for those exams?
Uh, IELTS and PGT, I guess it's around 18,000. I myself, I gave
Hmm.
PT academic, so it's 18,000, 18,900 or 500. And this OET, it's around 38,000. So I thought it's better
Okay.
to just go with PTE. Once if we can't clear it, then we can actually give another chance, not to just invest one time and a lot of money in OET.
Hmm.
And the band that you need is more of like, uh, there are like in PTE, if you score at some depending upon the band that you score, there will be a PR points. But those don't actually matters as of now. Because once you go and apply for the PR, it's going to be a long, I mean, like it will take so much time. And by that time, you will be already like what? This course will be expired because it will be only valid for 2 years, right?
Hmm.
So that's why it's okay. So you just choose according to your convenient whether you will be able to give this, I mean, prepare separately for PT academic and IELTS, or you just want to be comfortable with what we are used to, like in healthcare, like how we use our letters and write this health certificates and all. Because OET is occupational English test. So depending upon your
Yeah.
occupation, it will be customized, right? So that's how it is. But you have to also see the cost of it. That's it. And PTE, the results will be like it will be available in 24 hours, 24 to 48, max to 5 working days. That's it.
Okay, within the 24 to 48 hours, you will get the results.
Or max to max, it will take 5 days. For me, it took like 24 hours. That's it.
So what were the resources that you have used for the AMC? Step one.
So the primary, you have to follow guidelines. Therapeutic guidelines, there will be RSEGP guidelines for usual cases, and there will be rank OGS for OB-GYN. So there will be different guidelines. And this is where people get confused. It's like everywhere. You don't have like proper resource like Prepler or Marrow. It's like everywhere concise. So that's why
Hmm.
you have to integrate everything. I mean, if you want to do it by yourself, there are some courses. I mean, there are some courses that they will offer for coaching and all. but it's like almost 80,000 or 1 lakh above, which is not good
mm,
because by doing yourself, it's more easier and there are like free resources outside. So therapeutic guidelines is one, like guidelines is in general guidelines, and then use your e-medicine. That was one of it. And then you can take any theory, like if you have your already need like prep ladder marrow, you can just use those videos and watch those concepts. And this is it. And in immediacy, after you did this, after you do the questions and all, you will have this theory again. So it's like you're reading it again and again when you're doing the questions. You're just going to the questions and you just can highlight in the guidelines where is it asking from. You can have one theory notes, like you can watch, like you can attend these
mm,
sessions. So for me, what I did was initially I started to attend the sessions that were conducted freely by some volunteers. So I used to note down the notes, and I got some notes from like other friends. I mean, like there was some other people who were selling the notes, like there was emergency focus. So it was
mm,
they were selling it like they used it. So I got it for cheap, like I got it with other friend. So I used this notes, like they have this PPTs, like everything theory. But the theory doesn't help me much. It's more of like that's what you have to implement the subject. You have to implement
mm,
it. It's not just we just remember it, so that's why the right questions will be asked now. You will be able to answer it according to the situation. And this immediacy got introduced later in the journey, like it was introduced newly. So
mm,
if it's already there when I start my journey, I would just start with immediacy. So I'm just recommending the people nowadays, my other friends and everyone who are asking me about this journey, I would say give priority to immediacy, and then
okay,
have your guidelines. Guidelines are available freely as well. Okay,
mm,
and resources are available in Telegram. And next is just practice, practice. And then you can also give recall questions. So this is one topic. This is a main resource. Recall questions are something like those are asked before in the exam. So as people give the exam, there will be some persons who will just like everyone, me as well. I will just contribute like because this free groups are there. So what they do is like whenever they're done with the exam, they will just come out and they will just say this topic question came. This was asked by like this. This is the how it was asked. These are the options. Like depending upon that, how they can remember it. But the thing you
yeah,
have to do is like not rely mostly upon the question. You have to see what's the topic. That's it. What's the topic and in what ways they're asking. Because as I told you earlier, the exam will be having from Monday to Saturday in a month. So the same
mm,
question will not repeat, but the same topic will. So the topic will be repeated. So you will have the same topic, but seven different variations or multiple scenarios.
yeah,
Multiple scenarios it can be asked. The options can change, but that's why you shouldn't be relying more blindly on the recalls. You just have to
pick
thorough
up
with
the
your
topics.
theory. Yeah. And what I used to do, I used to have a partner. So what we used to do is like whenever the partner is there, we used to study. So what we did is like we listed down the important topics, recalled topics for like one last 1 year. So we started to focus on that. So we started to focus on that. We started to do this emergency questions. Like we just go to the emergency and you can just
Mm,
choose according to the topic wise. So you will just all topic wise questions you will select, and we would be able to do 100 or 120 questions. We used to do slowly. We used
okay,
to study line by line and everything. So
mm,
so in 10 to 12 hours a day, we used to complete like hardly 80 to 90 questions in a good day. On a good day, 100 questions. So that's the
mhm,
average. So once we do this, we're done with this recall questions, like recall topics questions. And then in this recall topics, the main topics will be already covered. So what you will do is like you will just go again and do some other any missed topics, like any other new topics have been asked. Are there any like other topics that have been missed? So like if you feel like some topics are like lacking, so what you will do is like you will just go back to the guidelines. We'll just check see guidelines is and guidelines. What it includes, it includes everything how the disease will be presented. Or in some guidelines, it will not be that, but it will be more of like how you treat the patient. Let's say like there is a
mm,
stroke patient, and like so when in like in what timeline you're gonna treat, what when you're gonna give the alteplase and tenecteplase, and when you're gonna do like the investigations, what are the how about the next step? So it will all include everything, and it will also have the references also. References is more of like from where these guidelines is taken from, like from articles and all. You can search it, but it's more of like a good resource. That's why I'm telling you, just follow these
yeah,
guidelines. That's where, and also when you're doing the UNDC, they are already taking it from the guidelines as well. So it's more of like the same thing.
mm,
So whenever you feel like you want to study more, whether this emergency question explanation, answer explanation is not enough, then you just go to the topic. you know the topic already, you will have an idea whether this is an asthma related topic or something. Then you will just go to the asthma guidelines and you check. And for asthma, it's different. The guidelines is not therapeutic guidelines, but there is this separate for asthma guidelines or something. So that's why it varies. It varies from like taken to the topic and all. And that's why for you to get resources for this guidelines is when you go to the e-medicine down at the end, there will be references that will be added. So there you
They will be
will get.
mentioned.
Mhm.
Hmm.
Yeah. And after this, what we did is like from December, we shorted down this because me and my study partner, we actually did our theory before itself. Like I did it by
Hmm.
myself. I used to attend these Zoom classes and everything. So it used to cover like usual topics and everything. So that study partner also covered by herself. So from December, what we used to do is like we started to doing like we made a list what topics we have to cover. So we started jumping on e-medicine. We started to do everything, and then by February end, I mean like by some time we were able to finish that file. I mean like that
Hmm.
important topics, e-medicine. And then after what we did is like we did any other list topics that are being frequently asked in the group or in the recalls that is not included in the file. And then what we did is like we jumped down back going to the recall files. Recall files are
Okay.
something, yeah, that they would just like because in an exam week, what it happens is like there are some groups where people will submit their questions, right? So there will be some volunteers, they will make a file. They will just add
Hmm.
this question. They will discuss with people like what can be the question, answer, and everything, and they will put the references down there, any related questions, screenshots, everything, emergency questions, and everything. So we started to study that as well. We started to study that,
Hmm.
and after when we did almost like one last 12 months recall files. So you because every month we'll have one recall file for sure. So you will have to do like 10 to 12 months to be sure.
Okay.
Yes. So recall files are more of like as it is. As it is, the exam, like other people give the question, then the question
Hmm.
will be there. With that limited information, we will try to solve it. I mean, it's already a solved file. I will send you a preview of it so that you will know. It's more of like collecting a data and just solving it with limited information with our guidelines. We just use our guidelines and everything. It's
Yeah.
just making sure that we're just getting used to how AMs usually frame the question. Because in emergency, what the thing is that the questions will be shorter. It will be shorter length. I mean, like in real exam, it will be shorter length, but in emergency, it will be like long, like 3 to 4 lines
Hmm.
or at least 5 to 6 lines, something. But in real exam, it will be limited because there will be hardly any more than 10 questions than that long. It will be mostly like two to three questions, three sentences. That's it, long.
Okay.
I mean, the length of the questions will be limited, so that's why you have to be make because in the three, what happens is like you will have a very limited information because it can
Hmm.
be it can be other diagnosis as well. Like they can give you a similar symptoms with the COPD and asthma. So we have to just make sure that how we're gonna differentiate it, and they're not gonna ask whether it's COPD or asthma. They will gonna ask you like whether you're gonna give a SABA plus LAMA or whether you're gonna give LAMA plus LABA or something like that. So it differs. Because
Yeah.
if we think that it's asthma, we're gonna answer differently. If we think COPD, the answer will changes. That's the
Hmm.
difference. And also the investigations or something. That's what I'm saying. We have to understand how the question is being asked, what they want from us. And for that, you have to develop that intuition. We have to practice a lot of questions. And eMedicine will have like at around like 5,000 questions or something. So as we are already prepared with FMGE, they were like people who already completed like more than 5,000. I mean, from my friends, I heard like they used to do 8,000 or something. I don't know about
Hmm.
the statistics about, but 5,000 is all the number of questions that eMedicine can offer you. And after this, in February, so we done with this important topics questions, emergency questions, and then we saw these recall files, and then we jumped into um, doing this what you call Amedex. What why we choose to do Amedex is because in Amedex the explanation will be broad, like it will include all the topic related topic, important topics. So what we did is like it includes 1,500 questions, so we were able to complete it in 10 days. We used to do like
Hmm.
faster, so we did that because we completed the whole Q bank. It's just 1,500, so we were able to cover the important topics again. So indirectly, what is happening is like we're just repeating revision. That's it in
Yeah.
a different manner. Initially, what it is, so initially it's theory, and then you do emergency questions, then you do recalls, and then you do some other Q bank that's covering the important topics. So what is like you're in a loop, but in a different way of approaching the topics. One time is just a theory, one time is a you're practicing emergency questions, and one time is a recall questions that are asked in the exam. And then after, in our last 1 month, what you have to do is like we have to revise again the important topics, and not just important topics, but the most like where you think like these topics can be asked. And then what we have to do is like we have to give the mock test. That's important. In emergency, they will provide us the mock test, and you can create your custom mock test. That's what the advantage is
Yeah.
like. If you yeah, so if you think like these questions and all, you want to manage, you want to solve these questions in this much time, so we can just do that. And if you're paying for one resource, make sure that you're using it for your its full potential. That's what you
Okay.
have to get the most of it because immediacy is it's pricey as well. And also, if you're choosing to opt for any coaching, like any coaching courses or something, make sure that you just don't believe it on whatever you're seeing in social media. You try to find someone that actually did the course, get the insights from them, whether you can find any free alternatives or less costly alternatives. That's it. Because not able to, because it's going to develop. Because what they're doing is some people are just selling it. I mean, they're making it as a like some are not even doctors. They're just making it like something like marketing thing. Like there is like one consultancy who
Mm.
was like making this like a something like sugar coated. Like they're saying that this is like easier and something you can just do it. Yeah, optimism is good, but giving a fake assurance is not. It's not gonna work. So you make sure
Mm.
that whatever you're investing the amount in it, make sure that it's gonna give the results for you. Just get the most of it. Ask them.
Yeah.
Just ask them. Just give them. Ask them to just guide you better. You get just also don't rely upon just one source. That's what I'm saying, people. If they're just getting this, courses, what they're doing is like they're just gonna blindly believe in them, and they're not gonna cross check with this because what happened is like I talked with one of my other friends. So he took this one specific. From one this provider, and they haven't even told him about emergency. What they told him is like just to do that from last 1 month. How are you gonna
Okay.
cover 5,000 questions in 1 month? It's not gonna possible because
Yeah.
1 month is the timeline where you have to just revise the topics and revise and the questions, and you'd have to do your mock test. So that's why you have to verify with multiple sources, but make sure that which is which correct. That's what like people will get too confused. So what you had to do, you had to verify with someone who already like been through or like who is actually doing the same thing as like you. That's what I did. Like I used to talk with people who already did the exam or who is actually preparing it. I used to ask
Yeah.
what the resources you are asking, resources you are using, which is helpful. What do you think about it? How much it costs? So you just the most details. And
Mm.
coming back, so I did this MedX as a revision for the topics. Started reading about it, and then after that we started to give mock tests in the last
Okay.
4 weeks. Mock tests in e-medicine, and then after mock tests, we usually gonna read again. Like mock test will take 3 hours or something, and then for to
Mm.
read all everything, it will take one day because we used to study at our own pace, like slowly, just understanding everything. So it will take more of like a 1 day or something. Just solve it. Just read it. Maybe just do one thing. Just solve it today, read something tonight, and go back, read it tomorrow, the remaining. But make sure that you solve, I mean, you read whatever you gave the answers, like about the mock test explanations, I mean, so that
Mm.
we will know like what to focus on. Because some emergency questions that I just want to emphasize on this. Whatever the questions that some questions have been asked in mock tests, the similar questions will be repeated in the exam. That's what is it.
Okay.
Exact same
Mm.
questions will also be repeated, like one or two. That's gonna be
Mm.
advantage, as I told you, right? If it's an easy question, because everyone might have did this emergency question. So if you're not able to answer it, then you're gonna have a negative, like negative
Yeah.
disadvantage compared to other people. That's why. That's why we have to make sure that whatever is here available for us, so just make sure you make more use of it. And then after this mock test, in the last 1 week, what you're going to do is like you have to make sure that you're not going to cover anything new. Whatever you did, whatever you studied, you're going to just revise, and then you're going to do 210 questions. This is what I was telling you earlier about. This is a 210 questions provided by AMC when you book the exam. It's like a complimentary questions they will going to give. It's included in
Okay.
e-medicine only, but AMC will give you the access for that link.
So that additional questions you can practice.
Yeah, additional 210 questions. And these two ten questions, how they differ is they usually differ entirely. Like more of like the length of the questions. As I told you earlier, it's more of like it's not gonna be like 4 to 5 question length. It's gonna be like a
Mm.
length like exactly like in length of the questions. I mean, one sentence or two sentences, like in the real exam. So you're gonna be familiar. You should be familiar with it. Like
Okay.
you have to get an idea what this topic about, what he wants from us, what they want from us, so how the answer should be. So we have to make sure that you have to be accumulated with it. So that's why emails is trying you, giving you more information, like from the
Mm.
start, so that you will be having a vast knowledge about like one topic. So when in the real exam, it's only concising like focusing on specific 2 to 3 words, like a keywords, then you will be able to point down. Yeah, this can be the diagnosis. So this can be like regarding the question, you can be able to answer.
Yeah.
Hmm. And yeah, that's it. And so in my exam week, that's where this is also important. In exam
Mm.
week is something like, let's say my exam was on Friday. So the exam starts on Monday, right? So from
Yeah.
Monday to Thursday, I still have some time. So, but in that time, some people will be giving the exam as well. So they will
Yeah.
be also giving us information like what questions they got and how the exam was and what are the topics, something like that. So what we're gonna do is like they're gonna submit the questions in the group. So what we will
Mm.
do is like we will focus on the questions. I told you, right? We were doing this recall files.
Yeah.
Mhm. So whatever the limited information that we have from them, we will try to solve the questions. We will try to see the guidelines, resources, and everything. We will try to put them together, and we will solve them, get to an answer, possible answer. And also, we will cover
Okay.
the whole topic. Let's say this question is about asthma. So he's asking about like a patient having moderate exacerbation, like moderate severity, like moderate. So like what you're gonna give, which medications you're gonna give, and like when you give the MGS4 and everything, when you're gonna give the adrenaline. So it all depends. So for us to know a specific when they're gonna give us like let's say in the first day they asked about asthma like a mild severity, but on the next day they might ask severe, like severe exacerbation. So you have to make sure
Yeah.
that you know everything about the topic. One day can be about simple asthma symptoms. One day it can be asthma investigations, what's the bedside investigation or something. Something like this. I'm just telling an example so people can be able to understand it better.
Yeah.
That's what, because this myth is there. They're saying that recall should be just repeated, so it's easier. That's how it's been circulating, but this is how it's a tricky. This is why it's tricky. Because you also have to understand, we, as in our level, we are very juniors to compare to some people who, some doctors who are giving like 10 years experience. Those are like
Yeah.
consultant levels. There's like residents. There are some people who are having families and kids. So in one way, we are in an advantage. We don't have any other, I mean, like that much burden to prepare with this exam. So we have to make the most of it. Yeah. And also during the exam, what one thing is we have to make sure that you're not stressing over the exam, and you have to make sure that time management that's important. And whatever comes to our mind as a first answer, just stick to it. Don't go change it as you're thinking. Like don't do multiple changes. That is also there. And yeah, time management, and that's it. I was not able to. I mean, I was not able to hold my thoughts while during the exam because I was thinking, exam gonna end sooner, so I'm gonna be done with it. Whatever's gonna be the result, but I'm just done with it. So I was just able in the rush. So I was able to complete earlier, like 27 minutes or something. So I was like, but later after giving the exam and I was thinking about what can be the results, then I'm just regretting that maybe I would have been a bit slower just thinking about most of it. But yeah, we don't know. We have our way of solving questions.
Yeah.
It differs. That's why don't compare it with other people, especially about your exam attitude. Like when you're giving the exam, how your behavior will be, how your thought process will be. So you have to just do as you're prepared. That's why giving the mock test will make sure that will help you a lot in the exam real time. So that's why you have to be focused the whole time in the mock test so that you will not have any distractions. That's why I'm telling you, whenever you do the mock test, you solve it. You read all the explanation related to it. So you will be able to understand it. So what I did extra was I did one time the mock test and I read
Mm.
the explanations and everything. Another day, I went and sat for the same mock test. I was just checking
Okay.
myself whether I actually understood the explanations or not, what is the explanation? I'm not just looking at the answer. What is this answer? But I was just thinking, what was the explanation? What was the explanation for this? What was my wrong? And why did I thought in that way? How this actually differs in this thought process and the reasoning for this. So you have to be clever. And also one more thing, I also use this Perplexity AI and ChatGPT, and you have to make sure you are using it in a good way because you have to make a command, give it a command that's it's not going to use any random. You have to be very specific in your like what you're giving the command is AIs, but they're going to be very helpful because some people are saying how we can use AI as a doctor or something, but
Yeah.
this is you are jotting down, you're just making your work simpler. simply like just making it easier for you to understand things. You're making it as a teacher or something. It's helping you as to understand things. So what you're gonna do is like you can include these resources, like put this guidelines, add this thing, and also for recalls when I used to solve, like if there is a something that I came across a recall, like someone sent this recall. So what I used to do is like I search in this AIs. So I will just see what is a related topic. Why not the other option? Why there is like what if there is another option? What can be the reason for it? So you have to think in multiple ways, not just one way.
Yeah.
You have to
So
so that you will
adapting that
be
resources also,
yeah. Yes. So
that
that's
will
how
be
it
also
is.
helpful.
Yeah. So that's how the overall my preparation was the whole time. I
Preparation and
mean,
the
yeah.
resources. So what are the
Yeah.
subjects that was included? It was only like pre or the para clinics or just only clinical subjects?
It's mostly like clinical, but in some ways there will be also preclinical, like our what do you call? Some other subjects will also be added. I will because there is also like subject weightage differs. Like one subject is having like for example OB-GYN, psychiatry, population health, and internal medicine. These four have like higher like weightage compared to surgery and whatever the other one,
Community
surgery
medicine.
and no, there's another one. This is what happens when I get like long term break, like long time break. Wait, because people from seniors, what I heard is like, I mean, from a study partner senior, what we heard is like it's better to focus on specific subjects. That's why we did. I mean, more emphasis on these subjects, uh, medicine and women's health. That's OB-GYN, and
Hmm.
then mental health, psychiatry, and also population health. And
Okay.
mhm. child health will also be there, and surgery. So these are like six, but more weightage is for medicine, women health, and child health, mental health, and population health.
Okay.
Yeah,
It's like
but in
population
paper,
health is like epidemiology.
no, not just that. It also includes other things. Population health, it also includes vaccinations and screenings. That's why it differs. It's like it's very confusing. That's what I thought before too. It's just epidemiology and all. Population health
Hmm.
and is mental health. Mental health is psychiatry. That's okay. Population health includes something like colon cancer, skin cancers, and all these things. And also, they're just not epidemiology. Just not like it also includes the like dengue and all these diseases, like contact diseases and everything. So it's like a web. It's like a different. They categorize it as a different, but we already know those topics. So once you go to this app, yeah, I mean, like when you select this population health, they will have a categories like the topics wise they will have as
Topics. Yeah.
well. Mhm. So then we will know. Oh, okay, this is not just this; it also includes these as well. Epidemiology is one of the is included in population health. It's one of the topic, yes, but it also includes other
But
topics.
there is no such topics like core anatomy, core physiology topics.
Yeah, no core, but that's integrated. That's what I was telling you before. Uh-huh. It's like it's just this medicine, surgery, women's health, child health, mental health, population health,
Okay.
and in
So what
this,
was
mhm, in medicine, they will also have this winged scapula and like anterior dislocation, posterior dislocations, and also like uh, and also neuroanatomy will also be included. So in the subclassifications they will have, but broadly they will just include it in just one section, like medicine. That's it, and maybe in surgery.
so
That's it.
in the e-medicine app we can see what are the subtopics that will be included there.
Yeah, yeah. I mean, yeah, and it includes like subject wise, um, and also once you go through this AMC handbook, they will have some pictures, like showing about something like just some clinical findings pictures. They will have like on
Okay.
examination if person is like having specific gait or eye deviations or something like anterior dislocations of humerus and also winged scapula and tongue deviations. These specific some images will be included in handbook, so that's what it's gonna be advantage. So you can use it in that way because some similar images will be asked in e-medicine in the actual exam. So once you're
Mm.
already familiar with it, so you'll be able to, okay, so this is this. You can be able to, and clavicle fracture, they will have a person having clavicle fracture, like how it looks like this and all. So it will also include all
But the
those. So
basic
once
idea
you,
we can get from that.
mm-hmm. If you have time, you can also actually cover it. So what I used to do before, when emedis is not there, what I used to do is like once I done with theory, one specific theory class, what I used to do is like I used to go do the specific related emedix questions, and then
Mm.
I will also do the emedicine specific topic questions,
Okay.
specific subjects. So that way you're already done with these questions as well. That's it. Mm.
So, what was the final advice that you want to give those who are wanted
Uh-huh.
to pursue the AMC
Uh,
as a main
yeah.
thing?
Uh-huh. So what I want to warn you guys about is it's gonna be time taking. You will doubt yourself, mind well in the journey, and it is also financially you have to be prepared. And also don't believe just one resource. Have multiple resources, but don't confuse. But don't let them confuse you. Because what I mean is just verify the information from others. Whatever even I am saying, just verify with other people. So even if I'm not conscious about some mistake, right? So maybe they'll be able to correct you. That's what I mean. And it's also some people when it's especially when someone is like coaching, especially when they are only like coaching you, just try to see they really want, what is their intention? They really want to help you, or they're just trying to make some money out of it. So just be cautious about it. Don't jump into a specific like, okay, I'll just take this resources. I'll just buy this resources. I will just buy this. Think again, because it's not just going to end up there. You just don't want to, I mean, regret it, because there are people
Yeah.
who are like believed in those courses. They took the courses because as an IMG, we know, like as an FMG, we know like how much is very burden we have when you're taking a step, especially financially. You have to make sure that you're investing in a good thing. Okay.
Yeah.
And yeah, that's it. And also one more thing, yeah, when I told you you're going to make you doubt yourself, because when I was back there down in internship, I was mainly telling this for people who are still in med school. Because when I decided to do this internship for this AMC, at that time, I saw like many of our batchmates like posting about like how they passed their FMG exam and how it's like they're
Yeah.
changing the name to the doctors and everything. So it just made me like, maybe we made a wrong decision. Maybe it's like I should have just gone to India and just clear this exam and then just do other thing. But there are like very few members which opted to this pathway. So that just made me like to choose. And this is what I mean, like I made the decision long back, and after 2 years I was able to clear this. So that's why I'm telling you. I mean, like, it can be different. Some people will be able to like pass it. I mean, like, because I choose to do this. That's why I'm telling you, don't just compare yourself with other people. Just do your own like what do you call this, own work and everything. Just move on with your own plans. You can get influenced, but don't get disappointed with comparing your others. That's it. And also, just yeah, just reach out to me if you have any doubts. I don't mind like helping other people, because there are people like who helped me before, so I don't mind. But if I'm sorry if I can't reply you like right away, but I'll just make sure I'll just make some time to just help you out. That's it. And I'm
Okay.
also thinking to just do this like subject wise specific course, but I'm not so sure. I have to think about it, because people are telling me to just post something related to these topics like content or something. But let's just see. Because I have to invest it, I mean, invest my time in it, because people are going
Yeah.
to rely upon me in some way. So let's just see.
It was inspiring to
Mm,
talk with you, and it was also
yeah.
inspiring because from the international medical graduate, as you said, in the
Mm,
from the FMG to passing and seeing this great score, great achievement in the AMC step one, and also wish you all the best for the further steps, step two, and also further your future achievements, Dr. Mohan. And also thanks
yeah.
for
Thank you.
joining this interview, and
Hmm.
it will be
Yeah.
hopefully helpful. And
Yeah.
guys, we will be providing the his personal ID, Instagram ID, and also the group the Mohan will be handling. And from there, you can get your doubts and the resources, and also you can contact him for any further details. Okay.
Yeah.
So once again,
Thank you, Bharat.
congratulations and all the best for
Yeah.
your future endeavors.
Yeah. Thank you, Bharat. Thank you for giving this opportunity. And yeah, thanks for this. It was a great session.